This is my dog Bella. She's doing something funny when she eats. I wish I had a video of it. I should have done that, but she does this licking thing after she eats. And she licks her front teeth, and sometimes she'll dig with her paw at this right corner of her mouth. And I've looked at all of her teeth. She's got tiny little teeth. She's got a little bit of yellowness there, but nothing bad. And none of these teeth are loose. None of them are painful when I touch them. Just really, it looks perfectly normal. But we're going to take an x-ray and see what's going on, because she's telling us when she eats, if something bothers her right up in the front corner here. These little tiny teeth. So we'll see what later on what the x-rays show. And we're going to do a full dental cleaning and everything while she's under anesthesia. What's his name?
His name's Critter. And he is going to have surgery today.
Got his belly shaved already, huh?
He does. We did an ultrasound on him, and we saw something weird in his bladder. So Dr. Bailey's going to go in and take a little bit of it out. Real life.
That's real life. Well, we can edit that out in post-production.
Great for your video.
What's going on over here?
I am making some puppy kits.
So these little kits, what do they have in them?
They have a lot of goodies in here. So these are what go in the folders of puppy kits. Usually they'll have a sample of food and a little measuring cup to go with it, a slip lead, their first dose of flea and tick and heartworm preventative, and then a lot of information. So we have information about a lot of the different vaccines that they can have, like their Bordetella vaccine, Lyme disease, flu, lepto. I think the only ones we don't have a brochure for their rabies and distemper parvo. And then information about flea and tick preventative, heartworm preventative, and pet insurance.
Pet insurance, that's interesting.
Yeah.
Pets can have insurance too?
They can. We really like to talk about that with puppies because they're so curious and they can get into things and they're small and they can get hurt easily and surgeries can be really expensive.
Yeah.
So that's a good thing that we like to talk about.
If you get them started when they're young, then they don't have any pre-existing conditions and they can be protected for that insurance.
Right.
So that little kit really gets everybody going, gets them on the right track when they start with their new puppy.
It also has information on this side about kind of what to expect throughout their lifetime of preventative care. So, you know, for each visit, what they should have ideally, and then information about spaying and neutering. There's more information in here about flea and tick preventative and potty training and things like that.
Cool.
Yeah.
Thanks, Stacy.
We may or may not be. It was a little, the tip was a little too big, so I'm not quite 100% sure I'm in. A little headscarf. You gotta do what you gotta do.
Yeah, I like it.
I just won't tie too tight. Alright. Alright, no pressure. Alright, let's check it out and see that we're in.
It's an art form to tie that tube into an exotic critter like that, huh?
Around, down around our
Yeah.
neck and back
And you
up
don't
here.
put pressure on him, but you can hold it steady.
That's the hardest part. Sometimes you can wrap it around the chest
Yeah.
and make a vest out of it. Alright, so we're gonna put him on 0.6 oxygen, 0.1 ISO for now. Just long enough to see if it's in. You what? Okay, I'll ask.
We were on the same machine, and she was like, she needed a razor. I could probably crush a watermelon. With a razor? Like a big razor? Or like a...
Not sure what she means by a razor.
So I can get to it a little better. And then that 4/0 suture, may I please have it so I can make some space sutures?
Tapered, correct?
Yes, please. Okay. Yep. Nice and wet. We don't want this to dry out. All right, thank you. What it feels like right here. Where it's gonna get interesting. There's so much blood vessels around there. It's gonna bleed a lot. I have a feeling. I'm just gonna put out some urine here. Part about doing a biopsy is you don't want to damage the biopsy tissue. There's the urine. Okay.
Right under you.
Okay. There you go.
Do you want a container for them?
We probably should send them out.
You have a guess of what kind of stones those are?
Yeah, usually these guys get the struvite.
Wow. That is
He's got a bunch of them
some
in there.
big ones too. Wow.
Okay, so we didn't show you the long surgical procedure because it was a long and tedious process, and Bella's teeth are so tiny that it's really hard to see on the video what we're doing. But I can show you here on the x-rays what we did. This is where she was licking at the top of her mouth. So if we look at this, get a bigger picture. Think this is her top jaw sticking down, and these are the big canine teeth, and in the front are the little incisors. And where she was licking on this right front upper corner is where it seemed to be bothering her. And if we look at you can see the line of the bone along here. That should really come up to the neck of this tooth. This is the root that's exposed, and this bone has eroded back. It should be here. It's eroded back to here, so we have some exposed roots that are sensitive. And you can see she had, 2 years ago, she had a tooth that was bad. We pulled that, and it filled in with bone. It's healed very nicely. So this is going to continue to erode away, partly because she's a Chihuahua. They just have bad teeth, and she seems to have this bone resorption problem, where she doesn't have very much gum disease from the outside, but underneath, she's got this inflammation going on that's eroding away her bone. So what we ended up doing is we actually had to extract all 5 of those teeth. And if we look here at the bottom jaw, we have a similar situation. And since she's my baby and I wanted her to feel better, it seems pretty radical, but she's got the same problem here. We removed all 6 of those teeth because it's inevitable. We'd be back here. She would be uncomfortable for another year, and then we'd be back here doing the exact same thing again. So that's another example. And again, her teeth, I could not tell from the outside. I was searching for a problem. I could not tell what. We found a third tooth here, or a third situation. This is on the upper left side of her mouth, up back where the molars are. There's the big carnasal tooth, the biggest tooth in their mouth, and right in front of it is this premolar, and you can see the white bone line here that goes along these teeth. This is filled in with bone right through here. See how dense the bone is around this root, and this root is just kind of sitting out there hanging. There's the bone line, and there's a little bit of bone left here, a little bit here, but it's eroding away. So this root is almost, the only thing that's holding this tooth in is this back root. So it had to come out too. So it's better in 3 to 5 days. She'll be over it. It's better for her to heal now and get these teeth out, because if we allow that to stay there, that will continue to progress down to these other teeth. So we saved some teeth for her.
You little nut. You're already a nut.
He says I'm up.
We've got to get you something to eat.
I'm rolling.
Get a little bit of food. Oh. You're really sticking my face. I didn't know you guys were rolling.
How did the surgery go?
How's his surgery go, Dr. Bailey?
It went excellent. He had a little bit of a mass on the base of his bladder, so kind of on the end he had a little mass here, And then we opened it up, he had multiple stones. So we're gonna check out and find out what those stones were and see what we can do to keep him from getting them in the future. So he's up and rolling. So now the most important part is getting him some food. Because these guys, unlike dogs and cats, they need to eat shortly after. So they can become very, very low in their sugar. And so we gotta make sure that we pay attention to that with them and keep them warm.